This is Call the Psychiatrist. I'm Dr. David Handley.
And I'm Dr. Abby Snavely.
In this episode, a listener ended her relationship with her therapist after she violated her trust. Now she's having second thoughts.
Say you like me, you better count the ways.
Listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified healthcare professional regarding any medical questions or conditions. This question comes from Leslie.
I've been grappling with intense emotions since ending my therapy relationship of several years of twice-weekly therapy. This decision came after my therapist breached my trust for the second time 3 weeks ago. I terminated 2 weeks ago, and I'm finding it incredibly challenging to cope with the aftermath. I find myself constantly thinking about my former therapist. I have frequent bouts of crying throughout the day. I feel abandoned, forgotten, and unlovable. Several times a day, I want to reach out to my former therapist. In fact, I've drafted several letters and voice recordings, but have not sent anything. I wonder if they even think of me at all. Did my therapist want to find a way to make me simply go away? Does my therapist even care about my departure? I don't know because they have not reached out at all, even though 3 weeks have passed. I hoped I would mean more to them. This is the most significant loss of my adult life. I'm unsure whether to formally pursue a final session for closure, or if doing so might lead to further emotional harm and mistrust. Any advice or insights on navigating this difficult situation would be greatly appreciated.
Well, I just want to start with a general observation about how intense a therapeutic relationship can feel. Leslie is grieving, which is understandable. Mm-hmm. The real hinge in this question, though, is around this breach of trust, which we don't know anything about. And so I think that could limit how practical our discussion is. However, I think we can speculate on a few scenarios. And
there's so many possibilities.
Yeah, I think we can teach something. This is pretty educational, I think, overall, even if we don't know specifically what went on.
Yeah.
What I think we should start with is whether what happened is an enactment. Is Leslie reading from a familiar script? Does she have a history where her trust is easily breached? And more importantly, does she tend to react by walking away? Does she punish people by leaving them? There's this echo that I have when reading this of the I hate you, don't leave me.
Right. And within that, I think some confusion, at least when I read it, about who did what to whom. Mm-hmm. There is this, the therapist breached the trust. Like you said, we don't know what that's about. But then Leslie terminated. Leslie's the one who ended the relationship and now feels abandoned. But the boundaries, they're very blurred together. Which I do think seems like an enactment, maybe even early parent-child relationship where it's very unclear by design who is responsible for both emotions and actions.
Right. I saw Leslie as the actor, and that at least on the surface, the therapist is disrespecting her boundaries. I don't chase after patients. I may feel hurt. I may feel stunned.
Sure.
I may think somebody would benefit from coming back, but I also think people have agency. They can.
Well, and I want to treat them like adults, right?
Yeah, I think it would be infantilizing to go chase after them and say, "Are you sure? Are you sure? Do you want to come back?"
But Leslie may be feeling very young right now, is some of what we're talking about too.
Right. Which again, that's why I think this has something more to do than just this breach of trust that she's talking about.
Right. Absolutely.
And I think the other element of that, along that same lines, is this idea: did the therapist do this to make her go away? Right. I mean, first of all, I would hope that the therapist is more mature than that.
But again, that's a very, you made me do this, right? It's well, that's not really how it works. Not that that's not something people don't say. Yeah. But yes, you made me do this. You made me feel this way, right? There's a hidden agenda, which again, I know people fear that, but hopefully that is some of the things you could be going to therapy to work on.
Yeah. It has that echoes of the past, the idea that Leslie suspects this is playing out in a certain way. Without
a lot of evidence, or at least evidence she gave us, right? It's all very impressionistic.
Yeah.
And including feeling like, she doesn't exist to the therapist just because they haven't met in a couple weeks. That's pretty interesting too.
I know. I was wondering if she regressed now because of the loss, or I have to think there's actually something going on in the therapy that was causing her to be regressed, which is why she left. But
absolutely.
Well, if any of this is correct,
yeah. I mean, yeah. We're pretending, but yes.
Yeah. Then the therapeutic thing to do would be to go back and actually understand this a little bit more.
Yes. Maybe for closure, but hopefully to work through something. And it might be more than just one session to understand, I guess, is the other plug I want to make there. But go ahead.
Yeah. Mm-hmm. Well, and to see if an important person that disappoints you may just be human rather than trying to hurt you.
Yeah. That'd be pretty good. I mean, and again, we hope that's true. And for most, I guess, mature, competent therapists, that's where it's at. And even if it's an enactment, meaning that the therapist got pulled into doing something or behaving like a character from Leslie's past, even unconsciously, like giving a chance to make it better, right? Mm-hmm. And I know you kind of alluded to that. It's like if people hurt Leslie, does she just like cut them off right away? That's also probably not something that really gives a chance at any understanding. That just keeps somebody locked in a kind of you're just a villain role, right? Like it's not very nuanced and there's not really growth in that. You just keep doing the same thing over and over.
Yeah, I wonder if did she point out the first time the trust was broken down?
That's a great question. If we like rewind this of like where are all the points of intervention, like that would be number one.
Right.
Several years of twice a week. I hope so. You could say something.
Yeah, you would think if she had identified it the first time, maybe they did work through it. Maybe it went really well and then it happened again. So that crossed a line for her. I don't know.
That's fair. Or maybe she has a 2 strikes you're out policy. Mm-hmm. Well, I mean, right. There are definitely people that are keeping silent score inside their heads for a game you don't know you're playing.
In a lot of relationships. Yeah. Not just therapy.
Yeah. No. I wasn't even.
Like married people.
I wasn't even thinking about therapy. Yes. That people do that, right? That there's kind of this mental catalog and in a certain kind of mindset, you can think the other person knows what they're doing or how it landed, but they can't know even if they know you really well. Like there's just going to be things that are missed because again, I want to emphasize the therapist and the patient are 2 separate people, even if it doesn't always feel that way. Yeah.
Or what if we throw all that out the window and just take this on the most superficial level? Leslie was hurt.
Okay, drag me back. I got to know.
Yeah. It has nothing to do with her past or unconscious wishes. She dropped this lady because this lady was not trustworthy. Like it was just a bad fit. She was like, never mind.
And she just realized it now?
I'm just saying.
Okay, you lost me with it has nothing to do with the past and nothing to do with the unconscious. Like, I'm sorry, but
but that's how she's presenting.
I know this is. I understand this is a thought exercise. It's just not how it works.
Right? Okay, because she's saying that she did this to me. Okay, that's fine. You can have good boundaries, and you don't have to subject yourself to that. But that's not to say that it's not going to be painful.
Absolutely.
This comes up with patients all the time. That just because a relationship hurts or the end of a relationship hurts, that's not evidence that it shouldn't end.
That's right.
The end of a bad relationship is still painful most of the time.
The end of any relationship. Yeah. And I think you are right to your very, very first point that like, regardless of what happened, this is grief. I mean, I think she has some influence maybe on how it goes or how it feels or plays out, but the loss of a relationship is going to be grieved, bad, good, or in between.
Yeah, I was making an exception for there's some of those times when there's that sense of relief and joy, but I think those are in the minority for sure.
There may be some pre-grieving with that too.
That's true. But relationships are complicated. This one is complicated, understandably so, and the grief is going to be messy and complicated too.
Absolutely.
Oh, but even if
it was bad though, she should still go back and talk to the therapist, I think.
Yes. It's still okay to go back and talk about how your trust was violated. That may be more satisfying of an end, but that's not to say it's going to prevent you from hurting or grieving it. But it may make you feel, I hate to use the word closure, but in this case, that might be appropriate.
I think it is appropriate. You could feel some closure. And I mean, again, maybe I'm violating your idea that we have to like throw all the other stuff out. I think it could be an empowering, more adult feeling decision to go have a discussion about it, or at least a less victimized decision or move. To be able to go back and talk about it and talk about what happened and hopefully hold your head high. And I think that feels like less of a kind of hierarchical or power structure sort of way to handle it. That you're taking, I don't want to say taking control, but like you're taking responsibility for ending the relationship and talking to them about it and not just like running away or punishing or whatever that is. Yeah, I think it just will feel more, stable about it.
Yeah, I completely agree. I think regardless of what happened, regardless of the scenario, I think the right advice is go back in person, not an email, not a voice memo, but to go back. I think if there's something good to come of this, I think that's where it would happen.
And hopefully there is something to learn going forward. I know in other episodes or with other listeners, people have talked about going to another therapist to deal with the breakup with the previous therapist. And I'm not necessarily recommending that, but Leslie's wondering if she's going to feel like this forever. I hope not. I don't think so. But if she's feeling stuck as the weeks or months go by, it might be worth talking to somebody else or just trying to figure out what the next move is so she doesn't get tangled in this grief process forever.
Yeah.
Forever is dramatic, but you know what I mean.
Yeah, that sounds right.
I like it when you say that.
I hope that's helpful. Thank you all for listening, and a special thanks to Leslie for the question. Please send us questions. You can do that on our website, callthepsychiatrist.com, where you can email us or leave an audio message, or you can email us directly at callthepsychiatrist@gmail.com. Finally, tell a friend about the show. Things are a little fragile in the production studio here. We need some encouragement. Take care.
Things are fragile. The hosts are fragile.
I mean, we're living on a thread.
Let us know. Do you like the short ones, the long ones? And most important, let us know that you love us. Like what? No?
All right. Goodbye.
Anyway, bye.